treated your
Both knees.
your lumbar spine.
We have an on-site, state-of-the-art lab with certified professionals for processing your own blood and bone marrow stem cells.
Being active is the most important part of my life.
And we're seeing ongoing deterioration of cartilage, instability in her ligaments. She's undergoing bone marrow aspirated stem cell therapy, which basically is deriving bone marrow from her hip and then preparing that tissue in our lab and then concentrating it and reintroducing it into the sites of injury.
We were introduced to Regenexx late last year, and as we started to look at this, we realized it could be a very valuable addition to our self-funded medical plan.
So where will all of this end up? I think where it's going to end up is a complete reinvention of orthopedic care.